AI model, AI-powered hospital information management system. Pradeep Suri, author, researcher, consultant, and AI/ML architect. The video of dashboard represents an AI-powered hospital information management system, HIMS, dashboard that uses a deep neural network, DNN, to monitor patient health risks. Here's a breakdown and explanation of each component from a HIMS perspective. Pradeep Suri, author, researcher, consultant, and AI/ML architect. Large Blue Diamond 1. Top section, Deep Neural Network for Hospital Patient Care. This section visualizes the AI model's internal structure. Input layer, left side. Captures patient parameters like hours of sleep, calories per week, number of visits, health metrics, blood pressure, heart rate, glucose level, etc. These are real-time or historical inputs collected via the HIMS from patient records or IoT health devices. Hidden layers. Multiple layers, 1 to 5, representing deep learning processing. Each layer transforms the input through weighted sums, biases, and activation functions, as seen in formulas like Z equals WA plus B. Output layer, right side. Produces risk classification, low, medium, or high risk. This is critical for alerting healthcare providers and prioritizing patient care. HIMS function. Integrates real-time data with AI logic to classify patient risks and recommend interventions. Large Blue Diamond 2. Bottom left, AI Risk Monitoring Dashboard. This section is divided into 3 mini visuals. White heavy checkmark A pie chart, risk distribution. Visualizes the proportion of patients in low risk, 60%, medium risk, 30%, high risk, 10%. HIMS Insight. Used by hospital admin and clinicians to get an at-a-glance view of population health. White heavy checkmark B bar chart, risk count. Quantifies patient numbers. Low risk, 120. Medium risk, 60. High risk, 20. HIMS Insight. Supports resource planning like ICU beds, staff scheduling, and early alerts for high-risk groups. Large Blue Diamond 3. Bottom right, line chart, risk trend over time. Tracks the month-wise trend, Jan to Mar, for each risk category. Low risk, slight upward trend. Medium risk, stable. High risk, slight increase. HIMS functionality. Enables trend analysis for decision makers. Assists in proactive healthcare planning and evaluating the effectiveness of interventions. Pushpin overall HIMS value summary. Feature explanation. Real-time monitoring pulls data from medical devices, air, and lab systems. Risk classification AI helps in early detection and timely intervention. Resource allocation supports efficient resource management in hospitals. Trend analysis empowers leadership to evaluate policy impacts and improve quality of care. Decision support enhance clinical decision-making with data-backed insights. White heavy checkmark conclusion. This dashboard is a visual interface for an AI-powered hospital information management system, providing deep insights into patient care using DNN. It helps hospital admins, doctors, and health policy makers to identify patient risk levels, monitor population health trends, optimize resource use, improve outcomes using predictive AI. Thank you.